Hello everyone, welcome to today's class on Agarose Gel Electrophoresis. My name is Purushothama, Assistant Professor, Department of Medical Laboratory Technology, Yenepoya School of Allied Health Science. So today, at the end of the session, you will be able to define electrophoresis, list out the application of electrophoresis, explain the principle and procedure of Agarose Gel Electrophoresis, and interpret the normal and abnormal pattern of electrophoresis. Electrophoresis is one of the laboratory technique used to separate and analyze the mixture of compounds like proteins, lipoprotein, nucleic acid and other biomolecules based on size and charge by applying the electric field. For example, if we take the compound like protein, so proteins will be having different particles like alpha 1, alpha 2, beta, gamma. So when we give the electric field, the particles get separated based on the size of the particle as well as the charge, whether it is containing negative charge or positive charge. Based on that, it will get separated. So next, coming to the principle, under the influence of electric field, the particles carrying a negative charge moves towards anode and the particles carrying a positive charge will move towards cathode. So I told you, so it is classified, so the movement will be based on charge. So if it contains if the particles contain negative charge, it will move towards anode side and the particles carrying a positive charge will move towards cathode side. Let's start with factors affecting movement of electrophoresis. The first one is strength of the field. Strength is nothing but the voltage. Voltage is required for the movement of electrophoresis so that it gets the strength for the movement. Next is size of the particle. Size, there will be two sizes, like if the particles containing a larger size, the movement will be slower, and if it is containing smaller size, the movement will be faster. Next, coming to the shape of the particle, if the shape is round in shape or a sphere in shape, the movement will be faster. If it is irregular in the shape, the movement will be slower. It also depend on charge of the particle, whether it is containing positive charge or negative charge, and also depend on viscosity of the buffer as well as viscosity of the supporting media. Next, in few slides, we will be checking on components of electrophoresis. Supportive media used in electrophoresis. Supportive media in electrophoresis is a material that helps to separate the molecules by providing a stable surface for the charged particles to move on. So electrophoresis can also be classified based on what type of supportive media we are using. If we are using a cellulose acetate, we call it as cellulose acetate electrophoresis. If we are using agarose gel, we call it as agarose gel electrophoresis. If we are using polyacrylamide gel, we call it as polyacrylamide gel electrophoresis. If we are using capillary tube, we call it as capillary tube electrophoresis. If we are using a paper, we call it as paper electrophoresis. Next, we will see buffers used in electrophoresis. Buffer is an important component for the movement of electrophoresis. It not only gives the pH, stable pH, but also it gives the ions so that the electric current can be carried out. So it is classified into two types. One is acidic buffer and basic buffer. Acidic buffer example is citrate buffer, which can be used for protein estimation as well as hemoglobin estimation. Under the basic buffer, we have barbitone buffer and tris HCl buffer, which can be used for protein electrophoresis. Tris borate buffer, tris EDTA buffer and tris phosphate buffer, which we can use it for nucleic acid electrophoresis. Next, coming to the stains used in electrophoresis. Stain is an important component. So once the slide are ready, it will be in a transparent form. So to appear the bands, we need to stain the slide. We can use acid blue stain, Ponchier stain and amido black stain used for protein electrophoresis. Sudan black and oil red stain can be used for lipoprotein electrophoresis, and ethidium bromide stain we can use it for DNA fragments estimation. Next, sample used in electrophoresis. We can use any of the clinical samples like serum can be estimated for protein and lipoprotein estimation, hemolysae for hemoglobin estimation, urine, CSF and other body fluids can also be used. Next, swing on to the application of electrophoresis, separating serum protein for diagnostic purpose. We can diagnose nephrotic syndrome, multiple myeloma, etc. In the case of hemoglobin separation, we can do it for thalassemia, sickle cell anemia. Lipoprotein separation can be done, nucleic acid studies, DNA analysis, CSF and urine analysis, vaccine analysis and isoenzyme separation. So coming to our main topic, serum protein agarose gel electrophoresis. First, we will see the principle. In serum protein agarose gel electrophoresis, under the influence of electric field at pH 8.6, All serum protein carrying a negative charge migrates towards anode, separating based on size and charge as they move through the gel. So, we are taking a serum protein, we are taking a sample of serum at pH 8.6, it will be carrying a negative charge. So, when we give the electric field, it moves towards anode. Some of the factors will be influencing the movement of electrophoresis, protein electrophoresis, that is amount of negative charge, as also the molecular weight of the protein, strength of the electric field, as well as property of supportive medium used. For doing Agarose Gel Electrophoresis, we need some of the requirements, that is the power pack to give the current, slide and agarose gel which we use it for supportive medium, buffer, electrophoresis apparatus, that is a chamber to keep the slide as well as to keep the buffer, samples we will be using, and other items like paper, wicks, fixative, dryer, stain and destain, etc. Next we will see the procedure for Agarose Gel Electrophoresis. The first step is to prepare the chamber. First we should switch on the power pack and keep it for some time. Fill the buffer compartments with each volume of 100 ml and the level should be equal in both the compartments. Next step is to prepare the agarose gel slide. We should take a clean alcohol washed glass slide, place it horizontally, add exactly 1.5 ml of molten agarose onto the slide using a broad tip pipette, and we should allow it at the room temperature for 3 minutes so that it gets settled uniformly and the agarose gets solidified. Next step is application of sample. We should take a thin strip of filter paper, soak it inside the sample and place it carefully on the gel at 1/3 distance from the cathode end of the slide, and we should take the slide and keep it inside the chamber for some time and place the filter paper wicks having a same width of the slide from on both the ends and connect the two buffer compartments using the wicks. Once the slide and wicks are connected, we should close the chamber and switch on the current and adjust the flow of current to 3 milliamps per slide. If we are taking a 2 slide, we should keep it as 6 milliamps. If we are keeping a 3 slide, we should keep it as 9 milliamps. So at the end of 2 hours, turn off the current. Next we will see the processing the pattern of slide. So once the movement is done, once we switch off the current, we should remove the slide and immerse in alcohol for 30 minutes in a refrigerator condition for the fixation of the slide. And later we should keep the slide in hot air oven or with using the hair dryer. We should dry the slide for 20 to 30 minutes so that the agarose get dried. Later we should immerse the slide in a desired stain for 2 minutes. Then we should take out the slide exactly after 2 minutes from the stain and we should de-stain using a 3% acetic acid till the background of the slide is clear. We should see the bands. So later we should dry it with hair dryer and observe the various bands. So if we want to convert the bands into electrophoretic pattern, we should use an instrument called densitometer. So once we keep the slide inside the densitometer, the bands will be converted into electrophoretic pattern. Next we will see the normal range for protein electrophoresis. The first one is albumin. The slide will be having around 55 to 65% of albumin, 2 to 4% of alpha 1, 6 to 12% with alpha 2, 8 to 12% with beta and 12 to 24% with gamma. So you can see in the slides, this is the normal range and normal pattern of electrophoresis. We will be having a peak at the albumin region and lesser at the alpha 2 and it goes on. Next we will see few abnormal pattern of electrophoresis. The first one is multiple myeloma. We can see a distinct M band which is appearing in between beta and gamma region. Next, in acute infection, we can see increased in alpha 1 and alpha 2 globulins, as well as sometimes we can see increased in gamma globulins in the case of acute infection. In the case of nephrotic syndrome, we can see dense narrow band of albumin region with decrease or absence of bands in globulin region. We can see the decrease in albumin region due to nephrotic syndrome. Next we will see hypergamma-globulinemia. We can see a dense band in a gamma globulin region when we see in the electrophoretic pattern. Next, coming to the bis-albuminemia, we can see two distinct albumin band. So one is the normal band and other one is slow migrating albumin band. At last, we will be seeing the summary. Electrophoresis is a suppression technique for charged particles. It works on a principle of movement of charged particles in an electric field. The components required include buffer, gel, electrodes and power supply. Agarose gel electrophoresis is used to separate the protein's nucleic acid based on size and charge, and electrophoresis is used for diagnostic purpose. Thank you. This is my reference.